We are just so incredibly lucky this morning. Dr. Zahir Saul mentioned to me after his talk last week that he had someone here who was from Gaza, who was here for the conference that they had on October 4th, and that she could come and give us her first person experience and answer questions and things. So we're so happy to have you. This is Mrs. Nurse.
Yeah.
Raja Musa,
Yeah,
who
actually.
is a nurse in Gaza and is the country director for that organization that Dr. Saul was telling us about in Gaza, manages 200 to 400 people, 300 to 400 people in this country, and has been living through war for the last year and many, many other years before that, I'm sure.
Yeah.
So please.
Okay, can I stand here?
Anywhere, yes.
Okay,
Thank you.
so, good morning.
Good morning.
Thank you so much for having me today. I will speak about myself first. My name is Raja Misleh.
Could you speak a little louder?
Yeah, okay, I will try. My name is Raja Misleh. I am the country representative for Midi Global. I was born in Gaza. My age is 22 years old. You catch my age now. Sorry, 52 years. My mind is 22. So I'm working for Midi Global since we start working in Gaza, actually since 7 years. And we have many programs on the ground inside Gaza. We have a stabilization center for nutrition. We're taking care of children under 5. We're taking care of elderly persons, for pregnant women, and also we deliver primary healthcare services for the IDPs in Rafah area. IDPs, the persons that internally displaced from North Gaza to the south. Now, over maybe 1.5 million located at Rafah area and Khan Yunis area. If I want to start to speak about the situation on the ground now, early morning I received a call from my colleague in the north area. His name is Abdullah. He's male officer. Actually, he described the situation in the north. If I describe the situation by words, I will never describe the suffering of the people inside North Gaza. Now they asked 3 hospitals to be evacuated. Kamal Adwan Hospital, Al Andonisi Hospital, and Al Auda Hospital, which are 3 hospitals working at the north area. And yesterday they attacked 2 of these hospitals, the Andonisi Hospital and Auda Hospital, to enforce the people inside the hospital to evacuate it and move from north to the south area. And actually he mentioned that over 60 persons has been killed during the previous nights at Beit Lahia area because they are bombing all over the world. This is not the issues. We are not focused on the political issue. Our concern on the ground as humanitarian workers is to focus in the humanitarian aids and items that need to be reached to these people, like medication, water, food, and medical items to be entered to the south and the north area. Now there's no borders, Rafah border and the north area, there's areas and another border, they open it to receive the trucks. Now there's no access to food or anything inside, especially inside the north area, because the operation now on the ground. Really, if I want to shift to another issue or my experience and what I witnesses during my trip at Shifa Hospital, I have been trapped at Shifa Hospital for 45 days.
You have been what? I'm sorry.
I'm trapped at Shifa Hospital. They are surrounding us.
Oh.
and trapped us in the Shifa hospital. I stay for 45 days inside the Shifa hospital. And during this period, actually, as healthcare providers or humanitarian worker, I witnessed actually many cases reach the emergency department daily. They receive more than maybe 1,000 of persons came like rush one time to the emergency department. And the majority of these cases, unfortunately, this is what I'm witnesses on the ground, children and women and elderly. I did not really witness like fighter age persons inside these persons that we received inside the Shifa hospital. And the severity of the injury, I'm witness children and women without legs, without arms, without a trunk. Even I witness one man, and I will never forget that, hold his kids in two plastic bags. Yes, I'm swearing God, that's what I witness. And he started to shout, this is my kids, this is my sons in this bags, which is during this period I witnessed the severity of the whipping that used. They cutting the people like for bags. Some children came just the hand of the person, we find just hand of the person and they came it, that's what we found in the place. Another case, which is, this is the most case that I will never really forget it. I speak about this case every day. It was for a girl, her age is 10 years old. She was at the operation department and she was completely burned. 95% of her body was burned. She started to shout, help me, doctor, please help me, I'm going to help her. She was suffering from severe pain and there is no access to sedation. There's no sedation to give her to reduce her pain. So what I can do, just I stay beside her bed and hold her hand. Just I stay beside her and until the moment I did not forget the sensation of her burned skin on my hand. Until the moment I smell the burned skin on my nose. Until the moment I am hearing his whisper in my ear, and she asked about her family. And unfortunately, the whole family has been killed in this accident, and they left her alone. I am lying on her, and I said that your family, she continues asking about her mother, her father, her sisters and the brother, and I'm said to her, they are coming, they are on their way, they will be with you during minutes. I keep lying until 4 a.m. early morning, and she passed away in this moment. And thank God that she passed away because maybe death decreased her suffering. And She passed away and she left me suffering until the moment because I feel guilty when she asked me to lie beside her in the bed. I cannot do that. I cannot do that because she's completely burned, so I cannot lie beside her. She passed away and she left me. Just remember the odor and the sensation of her skin on my skin. Sometimes I dream and she comes into my dreams. I'm begging her sometimes, please leave me alone. Because really I am until the moment feel guilty because I cannot do anything for her. This is one of thousands of cases I'm witnessing in Shifa Hospital. I witnessed a woman deliver her baby, and after 2 hours, she returned back to her tent inside Shifa Hospital because the IDPs, they took the Shifa Hospital as a shelter. They think that it is safe, and they start to have tents inside Shifa Hospital. She delivered her baby and she returned back to her tent after 2 hours. After 2 hours, she returned back to her tent, and you can imagine that she put her baby, and we need now for bathroom. As a woman, she wants to clean herself. She wants to feed her baby. We try to do like initiation for breastfeeding, but unfortunately, there's no food inside the hospital, and there is no access to formula. So what we can do? What we can do? Just we brought dextrose saline. It's a fluid we give them for the patient, and we put it in the bottle, and we try to feed the baby until we secure formula for her baby. Another case, which is maybe more difficult than this girl, it was for a boy. Also, his age between 8 to 9. His leg was amputated from here. And she started to ask me, please, after the operation, he started to ask me, please move my leg. He feel that his leg is there, but unfortunately his leg not here. I'm pretend, just I'm do like this. And I'm ask him, do you feel better? He said, yes, I am feel good, thank you. You can imagine, how can I tell him that his leg is not here? It's not exist anymore. This is maybe I'm select the simple cases that I met inside his street hospital when I was trapped. Sometimes I'm trying to avoid even speaking that issue, but I'm here in USA and I'm trying to send my people message. I'm trying to evacuate for ceasefire. We need ceasefire. The people inside Gaza, they are human beings. They are not numbers. They have the right to live, to love. They have the right to rise up their kids. They have the right to rebuild Gaza. Now Gaza, 90% of the homes are completely destroyed. Universities, school, everything is completely destroyed. The people now located beside the beach on tents, and the winter is coming. And unfortunately, I'm left inside Gaza, my whole family. My mom is there, my sisters, my brothers, my niece, my nephews, the whole family inside Gaza. Every day, I check my mobile and I expected that I will receive a call, and this call will say that the whole family is dead. I cannot sleep. Really, I cannot sleep. Sometimes I'm asleep just 2 hours, and I'm keep working all the day and the night waiting this call. This is what I am living. Not only me, but also the people inside Gaza. They are waiting and taste all kind of death. If they did not death from bombing, they will death from disease, from famine. Now they are eat one time daily and not a complete meal. And they try to save food for the children. This is the situation in Gaza. There is no water for drinking. They drink not clean water, mixed by sewage. Yes, because the infrastructure is completely damaged. Completely damaged. I don't know. Sometimes I'm, as a humanitarian worker, I'm asked how many children suppose or should be died to ceasefire. We need ceasefire. We need the border to be open and send medication items and everything for the people in Gaza. The people in Gaza, they are innocent. This is not their fault. This is not our fault. We need ceasefire. We want to live in peace. I met many Congress people, senators here in Gaza, USAID and the humanitarian committee, and I'm raise my voice. And I sent my people message. The situation in Gaza is very, very, I cannot even describe it. Really, I cannot find words to describe this. As a humanitarian worker, we are focusing in human being. We are focusing in healthcare providers. We need medication. We need to do advocacy and to support. We need to live in peace. We need peace. We need ceasefire now. Every moment means that we lost people inside Gaza. The healthcare system is completely collapsed inside Gaza. So I believe that this is the time to do it and pressure or advocate for ceasefire and live in peace. The people in Gaza deserve to live in peace. They are innocent people. This is not our fault. We are a human being. We are not numbers. And I'm here to advocate and make many persons to speak about the people inside Gaza, about the situation, about the suffering of the children inside Gaza. You can imagine child just 6 years, just 6 years. Now, there is no schools. They are responsible about the family. Since the morning, they going to lines. I told these lines as death lines. Line for water, line for food, line for bathroom. You can imagine more than 200 persons use one bathroom. You need to be in the line maybe at least 4 hours just to go to the bathroom. There is no water to take shower, no hygiene kits, there is no shampoo, no soap, nothing inside Gaza. Nothing inside Gaza. And if there's anything, the people cannot, they don't have money to have this items. So there's skin disease now among especially the children. There's they send me many photos actually. And this is the first time of all my life I witnessed skin disease like this. It is really weird. This is the first time I see that. There's no water. And if there is water, the water is salty, and it will be difficult to use it for taking shower. This is the life. Me, I'm speak about myself. There's two of my brothers has been dead in this war, and two of my brother-in-law has been dead, and two of them has been killed inside shelter, school for the UNRWA. They pumping area beside, and there's a shrapnel come for one of him and in his face, and he did people inside the IDPs. Midi Global actually we rise like a letter to protect the healthcare providers. We have missed one of our team inside Gaza in the north area. He working at Kamal Adwan Hospital. Kamal Adwan Hospital located at the north, and we have stabilization center inside the hospital. This stabilization center deliver care for the malnourished children. And he just go to check his home. On his way, they are pumping the area, and he did directly in the place. So we need to protect the healthcare providers to give us the chance to deliver care for the IDPs, to continue deliver care for the people inside Gaza, because we are working under a severe, really risky situation. So I hope that I send my message, and I'm here to raise my voice again and send my humanitarian message. We are human beings. We are human beings. We are not numbers. We are not numbers. We have the right to live in peace. We have the right to rise up our kids. We have the right to rebuild our buildings. My home. I'm continue the whole life building my home. 20 years. I am collect money just to build my home, and it's just like this. It's becoming like urban. We are 8 sisters and 4 brothers, and all of our homes are completely destroyed. Where the people supposed to go? Where? I don't know, to the sea or to the sky. Sometimes I hope that I am dead, because we are suffering every day. We are thinking of the family inside Gaza. I'm thinking of my mom, if I can secure for her food or water or shelter. I spent 1 month looking for tent for my mom. She's old, and I want to secure her just to protect her from the winter. Finally, I'm finding a tent, and now she is located at tent in the middle area, because they are moving all the time. They request them, you need to evacuate this area. My family has been moved 10 times. 10 times. They move from area to another area. By the way, there is no place inside Gaza safe. No places inside Gaza safe. I'm just keeping contact with my family every day. You are okay? Yes, we are okay. You are good? Yes, I'm I'm trying to do my best and help people, not only my family, the people inside Gaza, even the healthcare providers. Sometimes I'm responsible to secure food for them to guarantee that they will working and deliver care for the children and pregnant women. I'm contact this organization, and this organization just to secure food for the healthcare providers. We are working in a very challenging situation on the ground, very challenging situation. I will not be shy to say that. During my present in Shifa Hospital as a woman, and I have the dignity. I cannot go to the bathroom during my trip in Shifa Hospital because we are staying on the ground all the time. I am do urination at cup of tea because I cannot move. This is happening. This is happening with me during my visit at Shifa Hospital. We use saline for the bathroom. We use saline for 2 days. We drink it because there's no water. And left Gaza because I have 2 kids. They are studying outside Gaza. And when they cut the internet and all the connection between the outside and Shifa Hospital, my kids think that I am dead. For 1 week, they cannot reach me and they're thinking that I am already dead. So my daughter during this period, she's suffering from depression, and she forced me to leave Gaza. She said that, Mom, I have the right to see you. Please come to Egypt. I want to see you. I am left Gaza and stay at Egypt, and they came from Turkey, and I met her, and thank God I'm connect her with a doctor, and now she take 2 sessions weekly. She's good, but I'm one of the Palestinian women suffering from this issue. 100% of the people inside Gaza suffering from mental health issues. Yes, even the children, they have bad dreams. They suffering now from during the night. They do incontinence from urine, and even the women, they are pretend that they are strong, the mothers, but they are not. My mom, she is crying all the day because she lost 2 of their kids, and the situation is, you can imagine you live in a very small area and there is bombing around you all the day. So I contact many organizations to just contact her and do like psychological support for her. But at the same time, I have the whole family. They said that we are suffering from the same problem. We cannot sleep. We cannot sometimes even complete our task on the ground because the mentality health of them affect their functional on the ground. Yes, the people inside Gaza, 100% of the people inside Gaza suffering from mental health disease. And I am one of these persons because I am now, my organization start to contact me with doctor just to help me continue my life and release my depression or my traumatized that I'm has been witnesses in Shifa Hospital. Maybe the most difficult issues that I witnessed in Shifa Hospital, there was 300 dead persons outside the emergency department. They put them in a tent because there is no place inside the emergency department. They prevent us to bury these cases or these dead persons. And during the nights, the dogs start to reach these bodies and they start to eat some of them, which increase my pain is that cannot remove these dogs from this body. I may try, but unfortunately I cannot do that. I will never forget the worms coming out from the bodies. I feel these worms under my skin until the moment. I cannot remove this from my mind. My last message is that we need ceasefire now. We need the borders to be open. As a healthcare provider, we need medication. There is a huge shortage of medication inside prison. And so these persons, the persons has diabetes, hypertension. There is no medication for this patient inside Gaza. Many of NCD's patients, they did in silent. Nobody know about them because there's no medication for them. So we need this to stop now, not tomorrow, not after 2 hours, because every minute means people did inside us. I'm so sorry. Thank you so much.
Raja, would you take some questions?
Yeah, it's okay.
Well, thank you for sharing your story, and I have 2 questions. Now, if you could repeat what organization you're with that allowed you to want to go to Egypt and allowed you to come here to kind of talk. But also, I'm just wondering, the people in Gaza, don't you, there's probably not any energy left for anger, but aren't you so mad at the government, the Hamas, for putting you in this situation?
Look, as a humanitarian person, I cannot speak about political issues. My message now is completely humanitarian. I want to raise my voice. We need ceasefire. We need ceasefire. The people inside Gaza need ceasefire. What the UNRWA will do right now? The situation is completely I don't know. I cannot describe the situation by words. What the UNRWA will do? What the UNRWA will do? They are dying inside Gaza. They need food. They need water. They need ceasefire. This is the priority. Ceasefire. Ceasefire is very essential. Really, we need to open the borders. We need to to send medication, items, to help them. They are a human being.
Yeah, I just, I'm just gonna add one thing, so we operate.
Speak a little louder. please.
Sure, I'm sorry. Yeah, I'm sorry, we operate under 4 principles of humanitarianism as an NGO. And one of the fundamental principles is something called neutrality, which means that safeguards our staff on the ground. We don't make comments like this, but we do bear witness to what's happening there.
Yes.
Yeah.
And many of the medical missions that went, the physicians that were on the ground, including Raja and our staff and the team that has been operating there, has seen no victims other than the majority of them have been women and children over the last 12 months. The child that Raja spoke about, for example, right? That's something that we've laid testimony to. It's something that many of our officials are aware of. When you're talking about 16,000 to 17,000 children and women, we all know that was the IDF that was responsible for doing that. And when you have mass casualty event after mass casualty event of this happening, it demonstrated, a systematic issue that we're attempting to do. Another issue from a humanitarian perspective is the obstruction of humanitarian aid. So Dr. Rajat and her team, they want to be able to just deliver the aid that they need, but there is consistent obstruction month after month of not allowing it to get in, and it gets backed up, which is actually a violation of international humanitarian law, which, we know what party is responsible for that. We coordinate with the Israeli government through KOGA,
Yeah.
right? But KOGA is the institution that represents the IDF that allows us, or the Israeli government, that gives authority for who goes in. So we have this authority to operate as humanitarians, but we're consistently obstructed in ways that violate humanitarian law. So we need to be aware of how do we save these children right now? How do we save these men, women, and children? How do we deliver care? How do we deliver health care? And who is obstructing that? And how can we raise our voices to just make sure that we do that? It's not our place to speak on, those things. So I did want to make it clear.
The organization you're with is Med Global, right?
Yes.
Last week, we heard from the doctor from Med Global, and thank you.
Thank you.
There's maybe no use talking about step 2 until there's a ceasefire, because nothing is gonna happen until that. Another question?
It's not a question, and I want to thank you for coming here and testifying. I know all of the people in this room. This, to me, is not a war, it's a Holocaust. And the conditions you're describing, where you cannot leave, and there's no resources for life, is not acceptable anywhere in this world. When we get to the political question, we're not looking for whose fault it is. But we are, as Americans, responsible for funding the side that's causing this grief. And so it is doubly important that you are here and talking to us, and I thank you for that. And the ceasefire, sure, we have the resources, even in this church, to put together a container and try to get it through the borders with food or with medicine. We have those resources, but that's not the answer in the end. The answer is to make you free, to have a ceasefire, for us to be vocal with our own government, to say this must stop. And so I'm gonna stop talking because it is you who's here to answer questions, but I couldn't be more grateful to you.
Are we gonna have a fundraiser for them? Can we bring something and donate it to them?
It's not gonna solve this problem.
Well,
We
Med
have to
Global,
get it
they're on, you hear them on NPR, they're doing advertising here locally and I think nationally, to the extent they can. First of all, for the awareness, and Med Global can tell us if we wanna learn more on what good we might be able to do now, maybe to help the doctors, or maybe at least the hospitals, a place where people can find safety.
But you could raise money for food and drugs and everything else, but how are you going to get it through?
Right. So the answer is to stop the situation, not a little bit here. So why haven't we done that?
And our capabilities, but I think it's really complicated because I think it's just not the United States. I mean, in some ways, yes, we're giving them money, but we're not the only power in the world.
This is an important discussion. Do you think we could have it next week and make sure we maximize their time while they're here? I said, this is an important discussion, and next week we're supposed to be just discussing. I want that moving forward, but I wanna maximize the time of Abdullah.
Yeah, let's hear, what else can you tell us? I'm sorry, go ahead.
You mentioned that you had spoken to congressmen and senators. I'm really interested in what their reaction was when you told them what you told us.
Yeah, actually, I met 4 senators, and after that, I was really so happy when they rise like a letter for the Israeli government, and they ask them to open the borders and let the aid to come to Gaza. And they give them 1 month, right? From the,
Yeah.
1 month. This is what I received.
That was yesterday. I think it was in the news yesterday.
It happened last week.
Yeah,
There's a number of offices that we had went to, and they were all like moved and affected by the Jets' testimony. And again, you know, the way our government works in an advocacy, what we're advocating for is, you know, we want to be able to bring in medication, and so really simple. We don't even want to have broader conversations. Of course, the true prescription is a ceasefire. That's the real prescription at the end of the day, if we're gonna use medical terms. And so that was also part of the ask, and from Najat's perspective, I don't wanna speak on her behalf, but she just felt the need, I'm here, I need to speak to any community members that are willing to hear that call and who will assist us in making that happen. So we felt like there were people who were receptive to that and willing to make these simple humanitarian, they're basic needs. We're talking about really basic needs. If people are being operated on without pain medications, that should be unacceptable to anyone across all faith groups,
so I feel that I came really from the hell. And I came here to send my message and to ask from every person I met here in USA just to advocate for ceasefire. And I'm start with USA, the human rights, senators' offices. And I feel that if I'm a little bit succeed to do something or relieve the pain of the people, I will do. I will continue advocate and speak and contact persons to maybe a little bit relieve the pain of the people until we reach the ceasefire, which is very essential for the people inside Gaza. Yes.
Okay, this is not political at all, but I'd like to know a little bit about your background. I mean, where you were raised, how you got into your profession, and
I'm raised in Gaza, actually. I'm born in Gaza. And I'm studying at the first nursing, and then I take another specialist management university, and after that I'm finished master public health, and then I'm apply for PhD at Oslo University. And until the moment I did not finish my PhD, maybe inshallah next year I will finish it.
inshallah.
Yeah.
And how did you get involved with Med Global?
I started with Med Global 5 years ago. Since the office started to work in Gaza, I was the only person start, and after that we grow up the organization until now. We have more than 300 healthcare providers working inside Gaza. We have a primary healthcare center. This primary healthcare center receives from 500 to 700 cases daily. And we have 15 medical boards distributed all over Gaza Strip. And also we have 3 sterilization center. This sterilization center supported by WHO. This center especially, we create these centers for malnourished children under 5. And we have a huge project with UNICEF. This project delivers care for children also suffering from malnutrition and pregnant women. In addition of awareness, we involve or teach the mothers how to feed their baby, how to do a mark screening to identify if the baby is malnourished or not. And also we do like mental health session for the children. We do like recreation activities and we try to help the mother when she needs to go to the doctor when she detects any abnormal activities in their children inside their homes.
You actually, if I can quickly add, what you brought up about asking about Rajat's background is very important and wanting to know about her personal testimony, the history, how she grew up and everything. And I think that that's important, but it also, it reminded me, of providing context of what's happening there before. We've heard about Gaza many times before last year. Before October 7th, last year, there was 1.1 million people living with food insecurity. And they were surviving off of, they were still surviving off of entry of trucks at great scrutiny as well. And
Surviving off of what?
of 8 trucks coming in, even
Yeah,
pre-October 7th. So that makes you question, well, what were the conditions before that? The fact that we were there before should demonstrate that there was a lot more context that's attached to this story, and a lot more that we can do to change things from systematic ways and not kind of come in afterwards. Like if we understand the real history and roots of the situation and then we can better resolve it and prescribe a good solution for it, and an equitable one that makes sure that along with the rights that people have, that their basic needs and healthcare services are not affected regardless of who you are, right? I mean, that's a basic humanitarian principle of really doesn't matter if a doctor's serving you. They don't know your name, your religion, they don't know your political affiliation. All they care about is making sure that you get the medicine you need, the care that you need, and you survive. And it's an obligation on us as humanitarians to do that.
With all the trucks that we see that are not allowed into Gaza, that are lined up, especially in Egypt, are there medical supplies and things that, in addition to food and all the other things that are there?
Yeah, so it is being obstructed in a really, and I had mentioned this before.
Yeah.
It's being blocked and obstructed, and there's something called dual use. Dual use is a list of items that are under further scrutiny. So for example, let's say another conflict zone that's not Gaza, and there's a humanitarian crisis. If there's a humanitarian organization that wants to serve them, there's a dual use list. I'll give you an example. A flak jacket, right? A flak jacket is dual use because, well, you'll have journalists and humanitarian aid workers that need that. But they could say, well, this could fall into the hands of so on and so forth, right? Now that's a dual use item. In the history of all of this, the dual use items in Gaza are way longer and violate humanitarian principles. So you're seeing things on there like seeds. You'll see things on there on the dual use list like tent poles. You'll see bleach to clean clothing, soap, things that you'd never expect to undergo that scrutiny. And once we attempt to object to this and find out, well, why is this being held up? Why aren't we able to get this medication in? You won't get a clear answer and you'll be in this purgatory state for a long time. And then that's why you see this massive backup. So we're dealing with obstruction right now. Yeah.
And that runs into the political, but the reality on the ground is very serious. So if, for example, just to make sure I understand, a syringe could be dual use, is that correct?
Which would never be applied in any other areas. Now, I can't speak specifically on syringes,
Yeah,
But- Is it on there? Yeah, okay, so syringes, I guess, are on that list, so that is an issue. And you see the results of that, because even in normal conditions, forget like, the mass killing or mass catastrophic events, you still need those items.
Do you all use iodine on some of the patients?
Iodine.
Yeah, we use it. Yeah.
If they can get it.
Yeah.
I think we need a prayer before we do this.
Yeah, how much longer are you going to stay? Yeah, and then, yes, one more minute.
Going back to Washington,
I have a tour actually in New York, Washington, and New Jersey and other states, and after that I will return to Egypt.
To Egypt.
Yeah, to Egypt. I'm staying now in Egypt and working with the team on the ground follow up them, because there's between Gaza and here 7 hours, right?
7-hour difference.
Difference, yeah. Yeah, no, I cannot sleep actually. I wake up 2 p.m. to just have a meeting with the team and follow up on the ground. So I'm working day and night.
And in those meetings, from what you said, just to repeat or understand, you're learning every night that your colleagues and the people you care for are still dying. That this is a very real and present situation. This is not something that happened 20 years ago or even 2 weeks ago. This is as we talk and eat and drink clean water, these people are suffering. Is that the message?
Yeah,
Yes.
absolutely.
I wanted to say that, I have met 2 people from Egypt in the last month dealing with our company called Xfinity. And every time I have a serious problem, which is all the time, I call Xfinity and I get somebody from Egypt. And do you know they are the kindest, gentlest, and fun, and I leave that phone call. We talk about families, and I'm on the phone with an hour with Xfinity. Do you know why? Because these people are so beautiful, and they have something to teach, like you do, about what it's like to just enjoy life, to have a life, to be thankful. And I mean, it's a strange idea that I have brewing in my head when I heard you were from Egypt.
She's been gone.
She's from Gaza.
Oh, but you have, but something about Egypt.
Yeah, no, there's something. I'm located now in Egypt and I cannot return back to Gaza because they closed the borders.
Oh.
They will not let me
Right.
go. I'm a tribe, but they.
Oh, I see. So you just go to Egypt because you need to.
Yeah,
Yeah,
Yes.
and when I'm trying to return back to Gaza, the border is completely closed.
Yes.
Yeah, and
But
now-
your heart is like these people.
yeah,
Yeah.
thank you.
I will endeavor to offer that prayer that was requested unless we have more questions. I want to ask, thank you so much. We are going to continue to pray for you and for a ceasefire and do what is in our power, hopefully, to ask for a ceasefire. Next week, we want to discuss all the things that we've heard. And there is also, there was going to be a video today. I will send a link out. It's an hour and 20 minutes or something like that. So it is something that if you can listen to some of it, it's the Palestinian Reverend Munter Isaac, Christ at the Checkpoint Conference, and he has very salient words to share. Maybe we can watch that at home and then come and discuss next week. So we feel you to hear prayer. Holy God, who sees all of the brokenness in the world, brokenness of our hearts, the broken bodies, the broken homes, the broken cities from this war, and the broken motivations of those people who are continuing this war. We ask that you help us. Help us with our trauma, help us with our understanding, help us to take the actions that we need to take in our power to stop the suffering. Help Raja and all of her team and all of her family. Help them heal from what they've seen. Help them find time together, help them find safety and water and food. Help them with medications. And help those in power see their way to making that ceasefire happen now. Help us find the courage to lean on them to make it happen. We pray this as we know that you are with us in our suffering and in our pain, wishing that we would do better as your people. Amen.